Welcome to our media briefing. Welcome to those who are watching over the internet or listening over the internet. We're passing a lot of Senate bills right now, and will be this afternoon, and then we've got to go to House bills. Are there any questions from our media representatives today?
I wanted to talk about House Bill 442, now finally going to go to the floor.
The alcohol bill?
Yeah.
Okay.
The design curtain.
Okay.
Well,
there's a couple of different things that are in it now that have been sort of agreed
there are
to.
some things, and you know, I met with Representative Wilson last night, but we spent very little time on this, and I know there was an amendment that has gone into that, and I'm not sure what that is. But the basis behind this is certainly there's been a lot of complaint about what affectionately been called design curtain for many years, and the way it was put in place, which was with the grandfathering and the new construction, if you will. And then we complicated it a few years later with a thing called dual licensing, and then you've seen some interpretation of the alcohol laws by the commission at times that have been either liberal or conservative, and as a result, it's quite fouled up. So this is an attempt to fix that. A lot of folks who says, well, you need to bring us into the new age of alcohol in Utah. But if you go back and look online at various states, there are 50 alcohol laws across the country. They're not all the same, they're all different, and they all have various quirks tied to them, if you will. And this is not a strange concept. In fact, I was sitting on the floor yesterday and we looked up goofy alcohol laws on Google. and it went down and it created a list. And Utah was number 10 on the list behind Idaho and Nevada. So this is really, it just depends on who's stirring the bucket a lot of times on this, and it seems that it can draw an awful lot of attention. But this bill will allow people that have design curtains and are happy with them to leave them. It will cause, it keeps kids away from alcohol. We have an alcohol advisory board in the state of Utah. This changes the number and the makeup of that board, because the board has been basically made up of industry people. It's been very one-sided. So this balances the board, as we try to do with the alcohol or the liquor commission. And there are just several pieces in it. We've had issues where we've had alcohol in grocery stores, where in places they have gone and I used the example the other day of you put an alcoholic apple ale next to the apples and then market it as a health drink, and that practice will discontinue, and apple ales will be kept in the alcohol aisle with the other alcoholic beverages. And it limits where they can be displayed in the store. It doesn't limit the size, but it certainly puts the alcohol on the alcohol aisle and then labels it properly. So that's really the basis of the bill. There are a lot of other small pieces, but that's pretty well what it does.
In the restaurants, you can either have a wall or maybe a barrier.
You can have a barrier
kind of thing.
that would keep children from being up against the bar. They can't be seated at the bar now. Yeah. And this just establishes a distance where they would have to be back away from the bar. And this has been well thought through. This bill has been 5 months in the making, and we think that we've reached a standard and we've dealt with there's lots and lots of different players in the alcohol field. So you deal with distributors and retailers, and certainly the restaurant associations. You deal with churches, and the interesting thing, some of the most rousing conversations we've had through this process have been with county health departments. And so it's been a very interesting bill to work. Hopefully we've got the momentum to get it passed.
Is there any discussion though about extending the grandfathered? I mean, I guess you have it out to 5 years now, right?
Yes.
Is there been any talk about extending that any further?
You know, I'm gonna have to. I don't know what the amendment that went in this morning. I have had no discussion as far as that goes.
Any other questions on alcohol?
Well, that wasn't the only alcohol bill discussed today. It's Alcohol Day on the Hill, right?
It's an everyday alcohol then.
There's a joke there. Senator Adams could talk about the BAC bill that passed out of committee this morning.
Yes, it's a House bill. Representative Thurston is running it, but it actually passed out of the Transportation Standing Committee. I think most people are aware that it drops the alcohol limit from .08 to .05. A lot of people believe that it's an alcohol bill. I kind of disagree a little bit. I believe it's a driving bill. And I believe if you look at it, nobody can be cited for .08, .05 or anything unless they show impairment. And the key is impairment, and what we're trying to do is keep impaired drivers off the road. I've said many times that I kind of have a personal interest in this bill because when I chaired the Transportation Commission, we know there's a zero fatality goal that we have. But every month when we, at our commission meetings, the very first item on our agenda is the deaths, the fatalities that month. And it's pretty hard to conduct a meeting after reading 23, 35. In fact, I've got the Vice Chairman of the National Transportation Safety Board. You'll come in. In fact, why don't you sit here? I'll move over here.
Thank you, Senator.
And she's here because she gave testimony at the committee today. She's flown in from Washington, D.C. Will be here till this afternoon, but an expert in the field. And so this is driven by statistics. And as you see the number of fatalities, it's staggering. And in our infrastructure meeting, Director Berceras, Carlos Berceras, who runs our transportation department, he testified, and maybe you can give me the number, but how many people are killed on our highways every year?
More than 200, 240.
Well, 240 in Utah, but nationally.
Oh, nationally, more than 30,000.
30,000, and he said that's a 747 crashing every week. Now, some of you news people may follow that if a 747 crashed, but we have no news media coverage about 747 crashing every week on our highways. And we've got a big problem in America. And part of that problem, at least 10 to 20% of it, you'll have the statistics, are impaired drivers from alcohol. So this isn't an alcohol bill, it's a driving bill. And I think I'd like to qualify it that way.
Yeah, welcome to our
Thank you
media
for
meeting.
You may have some comments on it.
Thank you for
Anything you'd
allowing
like
me
to
to come
share?
here.
Or
I
maybe
appreciate it.
have questions that she can answer.
But maybe you can talk a little bit, for my colleagues that weren't in the meeting this morning, where you talked about the lives that you estimate would be saved by reducing the blood alcohol level.
Absolutely. Well, the NTSB, all we do, we investigate things like 747 crashes. We investigate plane, train, other things. So when we looked at the alcohol impaired driving problem, we saw that 10,000 Americans were dying every year. And when we looked at all of the different interventions, one of the most effective is having a .05 or lower BAC level. And so that's why we recommended all 50 states have that. If the states pass a .05 BAC level, they will see a reduction of 11% in deaths. And in fact, if you look at all of the United States, it's estimated that we would save 1,790 lives every single year if all 50 states had .05.
And Utah would be the first state to do this, is that correct?
It would be. A lot of people have misconceptions. Utah might be the first. It's got a 22-month delayed implementation date, but you've been aware other states are looking at this. Maybe you can help me with that.
Yes, so this is a relatively new recommendation from the NTSB, but we already have interest from several states, and a couple of them have bills that are live now, which are Hawaii, Washington State.
And Hawaii has a little bit of tourism, so we bring that issue up, but they're looking at this, and highly probable, I guess it's a medical doctor running it.
It is.
So Utah very well might not be the first state because Hawaii or Washington could beat us.
What other places have the .05?
We're actually the only industrialized country in the world that does not have .05 or lower. Every country in Europe, across the world, 100 countries have the lowest that they would have, or the highest they would have is .05. So we're really just catching up. All of them have .03, .04, .05, and they have no lower rates of drinking. They only have lower rates of dying in the crash.
Interesting, thank you.
So yeah, I was amazed at it's all of Europe. Some of us have been to Europe, a couple of places, you know, France, Italy, Switzerland. Is it 05 all over Europe, or what is it?
No, or lower. So
Or lower.
05 is the highest that they have in Europe.
Wow.
So Sweden, a few of the Danish countries. they have.
Canada also?
Canada as well, for almost all the provinces. It's varied depending on province.
And they have a lower fatality rate also because of that?
Yes, all of these countries, if you look actually at the amount of alcohol per capita that's drunk, they all have equivalent, or usually higher than we do here in the States, but they have much, much lower rates of alcohol impaired deaths.
Interesting. That's great.
Is there lower miles traveled also by automobile in those other countries?
It's usually, the studies have accounted for that, so it's controlled by that as well. So they've looked at deaths per vehicle mile traveled and also just deaths per population.
The monthly report we got, Gene, showed Utah is one of the lowest in the country, but it was vehicle miles traveled every month in the Transportation Commission. We get the actual number, but then we compare ourselves to vehicle miles traveled to other states. And so they have that data, but this vehicle miles traveled is a very important statistic.
You got folks been talking about it in the Democratic caucus?
We've been talking about it a little bit. We haven't taken any position on it. We've been waiting for the bill to come to us and see what was going to happen when it got into committee. And it sounds like it went through the committee today.
It did, came out, so we'll probably see it on the floor sometime.
Not pretty soon, actually.
Yeah, probably pretty
Two
soon.
Democratic votes against in committee.
And that was,
Uh,
I don't know
Senators
what,
Maine and DeBacchus, the only Democrats on.
that was in the Transportation Committee.
Did the NTSB, when they studied this, look at the comparison between European enforcement, how it's enforced in Europe versus how it would be enforced here? Because that's one of the concerns I get expressed from law enforcement people, is that they don't know how they can enforce a .05 differently than they're doing right now.
Yes, so in 2013, we did a comprehensive report, and we looked at all the ways that we could lower the number of alcohol-related deaths. The European, we looked at all of the European ones. We looked at studies that actually did meta-analyses of these. And there's one that actually just came out last month that's sort of the comprehensive study that was funded by the National Institutes of Health. And what that showed is that, controlling for the different types of enforcement, there was still an expected decrease in the type of, the number of deaths. And as you know, Canada has, they don't have as restrictive enforcement in many cases, and yet they still have lower number of deaths.
Canada, I thought, had a certain level of blood alcohol being an administrative
Exactly.
issue rather than a criminal issue.
Mhm.
Whereas this bill, it's all criminal. Talk about the difference there. Is that similar to other countries as well?
So it really varies. Almost every Latin American country, except for Peru, for example, has a .05 or lower. All the European, many African ones, Russia, I mean, the list goes on.
Australia.
But, yes, Australia. And so the ones that have what you mentioned is an administrative license revocation or administrative type law, is that they don't make it any type of criminal penalty. Many other countries do, in Europe, for example. So it just depends on, and that's, as the NTSB, we just recommend what will save lives, but as far as the enforcement, that's up to the jurisdiction.
So you haven't looked at what effect making it administrative versus criminal at a certain level has?
Others have. So we did this report that looked at all of the different studies, and the one that has come out really recently that has done a meta-analysis of all of them did look at it, and the administrative was also effective. They were both effective, having either the sort of more traditional way, or as Canada does, which is the more administrative style.
I'm wondering, Senator Adams, was that ever considered? I know you're not the sponsor of the bill, you're the Senate sponsor, but it seems like making between .05 and .08 an administrative or some kind of a less than a criminal violation would solve some of the concerns that have been raised about it.
I wasn't involved in the drafting, I got it as it came over from the House, but those, we have as I mentioned before, a 22-month implementation date, and I think we need to put this in place, and some of those things maybe be able to be looked at. There's questions about a restricted license for work. We surely want to try to encourage people or make sure there's a cause and effect of drinking and driving, but we also want to make sure we look at other issues. So one of the things that I just became aware of, and I probably should have known this, but if you're a commercial truck driver, what alcohol level is it?
0.04 and your license is, you're off the road.
You're off the road forever.
At 0.04.
Is
So,
it
I mean,
across the country?
Mhm.
Because that's federally mandated.
It is, it's across the
So, I mean, that's lower than 0.05. And so, I mean, it's not a, the reason for that is we're not trying to deal with alcohol, we're trying to determine impairment. And that's the statistic is, and it's, it all of a sudden clicked in my head that when you're impaired, you probably say, do I feel like driving or not? Well, of course you're impaired, you're gonna feel like driving, you're gonna feel like you're not impaired. And that's the catch-22 is when you are impaired, you feel like you're not. And how do you determine that? And 0.05, there is impairment for sure, that the statistics show that, and you probably shouldn't be driving.
I wonder if, I know you're saying this is a driving bill, not a drinking bill, but with some of the new safety measures in your bill, Senator Stevenson, or the House bill that you're sponsoring over here, will those also help reduce these DUI related deaths that we're talking about? Do they work in concert in any way? And I wonder too if the NTSB has any thoughts on that.
Well, they certainly could, but this bill is, we haven't heard too much about this until the last few days, but they certainly could because the bill that we're running actually puts money into enforcement, it puts money into education. We would anticipate that our alcohol and abuse committee in the state would put together a program that could be used in 8th grade classes, 8th grade health classes, and then that we would turn around and also use some of that money to sponsor alcohol prevention programs that would be taught with drivers training. And so, you certainly may want to make everyone aware that it's not 0.08, it's 0.05 if that law passes. But these could work very well in concert with one another. That certainly wasn't the intention when we started, but that's kind of an added benefit, I think, to what we're doing.
I'm just
Okay.
wondering if you're familiar with some of these changes that are being talked about on the alcohol policy side and stating if those help the efforts to lower traffic fatalities.
I've been really keeping my eye on Utah lately. I've been here twice in the last 3 weeks. I know. It's been great to fly across the country and see beautiful Utah. I actually used to come here on vacation, so it's funny to be here so frequently for work. But we only look, because we're the NTSB, we only look at laws or effects related to transportation and safety. But maybe related to that, it'd be important to know that the sort of unexpected consequence when people first started looking at this is that it's not just looking at people who are between 0.05 and 0.08, which naturally you would think that's that narrow group that we're trying to affect, but it affects people at all BAC levels. So even though it's a 0.05 law, people are less likely to drive when they're high BACs or hardcore drunk drivers, as you say, at 0.15 or 0.25. So it's really addressing a broad spectrum of the problem. I mean, it's just basic prevention, and that's why we promote it, because it's not about drinking, it's about separating drinking from driving.
Thank you.
We need a caucus.
Any questions from our viewers?
We do have one online. It asks, can we expect distracted driving laws to perhaps next session, stricter laws for distracted driving, as UDOT reports a similar number of deaths related to distracted driving as driving under the influence?
We talked about that in committee, and that's obviously an issue. Texting while driving, no one would say you should text while you drive. But the comment that was made was that that's a temporary, even though it is a big phenomenon, it's a temporary event. When you drive impaired, it's the entire time you're driving. And there is a little bit of difference there, maybe you could speak to that.
That's true. We look at, I mean, we certainly have recommendations related to distraction as well, and we're against that, any type of
Yes.
problems when you're driving. But distraction is while you're actually doing that activity, and that's why we say you shouldn't be doing it. But when you're impaired, you don't have the judgment, it impairs you the entire time you're driving home. So this, I think the .05 bill just puts a clean white line for people. They know that if I've had some drinks, I shouldn't be driving, and that's what it does. I don't know all the psychology, but the psychologist will tell you that it does just stop people, no matter how much they've been drinking, a lot or a little, from getting behind the wheel.
Thank you for being here. And thanks, everyone, and we'll see you all tomorrow.
Senator, can I just ask you real quick, the tax legislation, we're gonna see the sales tax bill coming out, or what's the?
You talking to me?
status on that? Yeah.
So, I know that the House is working on, working with their body to try and see if that's something that they can pass at this point. We've already, looks like we could pass something here in the Senate. We've caucused about it. So, we're just waiting to hear if we've got a green light. We're still working on it also. But we have a little more definition, and we'll see where we can go from here.